Let's get right to it. It's 2:07 on a Friday. Of course, that's time for it's our Centric Health sponsored segment. We got Dr. Bridge Bomby. Here's what we've been doing all week. We've been talking to Dr. Bomby. He's been so important to this broadcast to answer your questions about the coronavirus and how we've been dealing with it. We've been collecting your questions all week. Mr. Flores is going to be asking the questions of Dr. Bomby here, and you are encouraged to call in. If you have other questions, 842-5376, we will interrupt what we've got to let you speak to the doctor right on. But we're going to, Dr. Bomby, you with us?
Yes, I'm here, buddy. But before we go into the question and answer session,
Yes, sir.
Can I make a couple comments?
Sure.
So I think it's okay to rave about the Californian weather, but we have to rub it in.
Yeah?
Just because those poor souls are suffering in Wisconsin and Texas.
Yeah.
So why don't we send them a get well card instead of rubbing it in?
Okay.
But it's okay.
All right.
Yeah.
All right.
Right?
We will send them a get well card. See?
And the second is, you mentioned about the running water in Mexico City. So you're talking to somebody who didn't have running water most of his life when I was in India. So we had a dug well where we would pull the water, bring to our home, and used it sparingly. Never had we used a bucket and poured the water on our head to take a shower. So the times were different, and drinking from a pond was clean water. So those are the things we grew up back in 60s in India.
Boy, I would, we ought to devote a time to, if you would allow me to pick your brain about that. So you grew up without running water? Is that what you said? Without plumbing?
Running water. Of course, no plumbing. And I was 9 when the electricity first arrived in our village. And it still arrives infrequently. There are sufficient amount of cuts in electricity delivery even now.
Oh, that is amazing stories. I'm going to follow that thread with you sometime. Not today, but we'll do it. And thank you for your good thoughts. And of course, I'm just having fun with our folks on. So many folks make fun of California and our kind of wacky laws here that when we get some good weather, I like to stick it back at them. But anyway, your thoughts are appreciated. All right, Mr. Flores, I'm going to turn this over to you first because you're just coming off your bout with COVID, and I'm going to leave it up to you. Do you have a question for Dr. Bomby about your own case?
First, how long am I going to be fatigued for, Dr. Bomby?
JR, who knows? That falls under the category of who knows, because it's impossible to each his own. And I hope sooner than later in your case, but that's an unpredictable answer.
Okay.
Excuse me, but Dr. Bomby, it's typical, though. Is it typical for people to remain kind of with the brain fog and kind of just lethargic for a while?
To each his own. See, the one thing that's consistent about the virus is its inconsistency. It never manifests the same way. I've had couples who are 90-year-old. One would end up in the hospital, other would barely know it. And I've had similar circumstances in much younger people. So the salient feature of this virus is its unpredictability. And that's the one notion that people who trivialize the virus like to expound on the side, that the ones who get the milder version, they call it flu-like. And those enhanced intellectuals should understand that they're real people who suffer a lot because of their committed uncivility to use the preventative tools.
Okay. All right. What else, JR? What you got?
My real question is, how much immunity do I have right now that I've just recovered from the virus, and how long would that immunity last?
So that's the $64,000 question, and we have learned quite a bit about it. You have an excellent immunity right now. So as to the complete recovery from the infection, that's unpredictable, but your immunity should be excellent. The current recommendation is that you don't need vaccination at least for 6 months. CDC says 3, I would say at least 6 months, and then to only 1 dose as a booster. But the probability of your immunity lasting for a year or 2 is looking better and better, and that's good for all the humanity.
So you're saying that when it's time that if you're somebody like JR and you've recovered from COVID, that you have enough immunity you can probably last up to 6 months and then only get 1 dose, not both doses?
Exactly. So even that's a guesswork too. It's conceivable that people who had infection recover from it, they don't need any shot at all. So as a precautionary measure, because we don't know enough, we say at least get 1 shot, and that's more than enough. A person, for instance, Richard, who had infection, had a much more severe encounter with the virus, and had a more holistic infection. When we get the Moderna or the Pfizer shot, it's a very specific targeted immunity that's created for the spike protein. For the people who get the infection, it's a more holistic experience. And empirically, I would say they are probably as good, if not better, than the people who get the vaccine.
Huh. Okay. All right. JR, go back to the questions. What do we got?
Another self-indulgent question, Richard. Okay. So I can't. I have immunity, but let's say I get around somebody who is positive. Can I, in turn, pass that on to somebody else, like my mother or somebody else that I happen to come around afterwards?
The probability of that is low, but that shouldn't allow you to lower your guard. Whether you're vaccinated or infected, or you had the infection in the past, you have the immunity. But one thing we don't know for sure is, especially in the case of the vaccination, how strong is the asymptomatic infection likely afterwards. In cases of, and part of the fact is that we haven't followed too many of the people who are infected or vaccinated and swab them at frequent intervals to give specific answers. So you respond the best way possible by practicing preventative measures in a relaxed manner. You still can, if a person has infection or had infection and recovered and vaccinated, it's okay to have the grandkids and friends come over. But still, don't go back to 2019. Still practice the preventative measures in a little more relaxed manner.
Oh, very good. All right. JR, what you got?
I still wear my mask around, Richard, just so you know.
Well,
when I'm out in public,
so.
I still practice social distancing, and I still wear my mask. This next question comes from Pam out in Seven Oaks. She says, my pickleball friends tell me that the Pfizer and Moderna vaccines are useless against new variants from South Africa and Brazil. Is that true? And if so, do we have to start all over and take a 3rd shot?
The current evidence suggests that both Moderna and Pfizer, and actually all the other, the Novavax and AstraZeneca vaccines, prevent against hospitalization and death. Those are the 2 hard endpoints we have to protect. If you can avoid hospitalization, if you can avoid death, it's a win. So all the currently available vaccines prevent death and hospitalization. The milder version of the disease is less protected. The range is 50 to 75% protection against that, but the severe disease is 85% protected. Death and hospitalization 100% protected. So no, do not argue with the strength or the protective powers of the available vaccines. They're sufficient and they'll save your life. So the detailed conversation about mutants that can eventually arise, that can work around the prevailing immunity of the current vaccines, may become relevant if we are not able to vaccinate the world in a quick manner, because every time a person is infected, there is a chance that the virus can mutate in a more malignant manner. But if we are able to vaccinate the whole world. And digressing a little bit here, JR, but that's what the COVAX program is all about. It's not about the U.S. It's not about us in Kern County. It's about the world as a whole. We have to make sure the world as a whole doesn't allow the virus to replicate and thus find a more malignant mutation that will send us to the drawing board. But right now, we are not at the drawing board. We have our bases covered.
That's good news. Excellent. All right. What you got next, JR?
This one's from Hannah in Lake Tahoe. She says, I heard that when you have a bad reaction to a vaccine shot, it means your body is working harder and you have a stronger immune system than people who didn't have a reaction. So does it mean you will have a super strong immune system if you had a bad reaction?
Generally speaking, yes. Younger people would have a stronger response. And they would have more of myalgias, arthralgias, muscle pains, joint pains, fever, chills, more like flu-like, or even some slightly worse form of flu. Yes, that's generally a rough estimation of the immune power, but it's not a translatable in a quantitative manner that. The lack of response doesn't mean lack of immunity. The presence of response certainly suggests that that person has a better immune system. For instance, I didn't have any side effects. I wouldn't call it side effects. I didn't have any effects pertaining to either the first or the second shot. And part of that is because I'm older. As we get older, the landscape changes, our immunity lessens, our tendency for inflammation increases. That doesn't mean that I don't have the immunity against the virus. It just means that the younger person has more likely a stronger immunity as a whole in life.
Excellent. That's good news. I'm feeling better, JR. Go on.
This is from Bob in Southwest Bakersfield. He wants to know about something called a pan-coronavirus vaccine that he's told will work against hundreds of new strains. Is that true?
Okay, that's a futuristic projection. What we're thinking is that the current pandemic has initiated a platform that was previously not used, which is the messenger RNA driven. So it's conceivable that we can use metagenetics to have a more like a cannon shot approach. It's a precise cannon shot, but you could possibly have a vaccine that can at the same time shoot multiple targets with a degree of precision. So that's futuristic, but it's on the table.
Huh. Okay. All right. Oh. What's next, JR?
This is from Steve in Pismo. He's confused. He said someone told him that even with the shots, they can still get the coronavirus and spread it. Is that true?
That is true. Because the efficacy is not 100%. So if you look at all the Moderna and Pfizer vaccines, the efficacy is 95%, meaning that if 100 people get the vaccine, only 95% will completely, will not get symptomatic disease. 5% will get symptomatic disease, and it's conceivable that more than 5% will get asymptomatic disease, meaning they will harbor the virus and they can actually spread it to others. So that's why it's important to reinforce the fact that it's a protective shield, but it's not an impenetrable shield. You still have to practice prevention till the time the herd immunity has finally triumphed over the virus.
I think that's so important, Dr. Bomby. We're talking to Dr. Bridge Bomby, who's answering our questions on the coronavirus. So I've had 2 shots. I can feel pretty good about myself, but I have to be aware that if I go into an area where people are not vaccinated, that I could be carrying the virus that's being suppressed, I guess, by my Moderna shot, but I could still spread it, correct? So I have to be careful about that?
Richard, you got Pfizer shot. So, but yes, that is exactly the point, because just because you're vaccinated doesn't mean that you can't have asymptomatic infection, doesn't mean that you can't be a vector, that you couldn't spread the virus. So the civic duty still demands that you wear a mask and maintain preventative measures.
Okay, very good. Next, JR.
This is from Dodger Dave. He says he had his second Pfizer dose 2 weeks ago. If he is exposed to somebody with COVID, should he get tested?
Absolutely not. So the current recommendation is the exposure in persons who have had the 2 shots, especially a week after, then that's the whole purpose of vaccination, is that you create a degree of immunity. So Dodger, what's his name?
Dodger Dave.
Yeah. Dodger Dave doesn't need to worry about it. He just needs to practice preventative steps. But if the exposure occurs, that was the reason he had the vaccination. The exposure shouldn't contaminate him.
All right. What else you got, JR?
This is from Linda in Northwest. She says, my husband and I are about to get the first vaccine shot, but he has an autoimmune disorder and is being treated for that. Is it okay for him to take the vaccine?
I have asked the oncologists, the cancer doctors, and the rheumatologists. So the consensus is everybody should get. Actually, when people have, this comes from the cancer society in America, that people with cancer actually have immune compromise and they're more likely to have an adverse outcome with the virus. So they should be on the front of the line, not worrying about the consequences. The consequence is bad if they don't take the vaccine. Similarly with the rheumatology and the immunology, the only concern is when a person is on on immunosuppressive agents, steroids or others, they may have a window where they should avoid the vaccination. And that's a more specific answer that has to be addressed by individual doctor for an individual patient.
Interesting. Okay. You got anything else, JR? Yeah.
Yeah, this was from Carlos in Bakersfield. He says he's about to get the second vaccine shot, the Pfizer, and he's confused about what that means. Is he immune from getting the virus? Can he still be a carrier? And he wants to see his grandchildren in 2 weeks, but he's not sure what to do.
Generally speaking, if you've had the second Pfizer shot, week after that, you should be okay to hug the grandkids. But remember, safety saves. It's not a get home free card. You really have to respect the virus because we know so much about it now, but we still know so little about it. So we have to respect what we don't know. Yes, you can extend, you can reach out to the kids and grandkids, but still wear the mask.
Okay, Dr. Bridgebomby with us. Okay, that wraps up our questions there. Before I let you go, any new developments that we should know about that are important on the horizon here, Dr. Bomby?
Multiple. So it's been a busy week. Today, for instance, Pfizer study came from Shiva University in Israel that shows that 2 weeks after the first Pfizer shot, there's 85% protective coverage. And that allows us to disseminate the virus to a larger population instead of preserving the second dose. And that's extremely important. But the one that I like the most is the logistical answer to the preservation of Pfizer vaccine, because it required 94 degree minus 94 degree temperature. But they changed the paradigm. Now a regular freezer is able to preserve the vaccine, the Pfizer vaccine. So same for the Moderna. So it makes no sense for the illogical governmental steps that demands that the Dodger Stadium and places like that be the places where the vaccine should be administered. People come to my office, Richard, and they argue, why can't I get the vaccine here?
Yeah.
I said, I pull my hair, I can't find the answer. And sometimes government is not the answer. This is a classic example. Give us the damn vaccine, we will do the right thing.
Let you
So those are
guys.
two important things, yeah.
Yeah, let the people, let the experts, let our doctors do it for good. I totally agree. Dr. Bridge Bombi, thank you, sir. Always interesting to have you on, always revealing. I appreciate it, sir, and have a great weekend. Yeah.
You too, Richard.
Okay,
JR,
buddy.
Godspeed, buddy.
Thank you, sir. Hey, one more quick question, Dr. Bombi. How many times can we spoke off air about me donating some convalescent plasma now that I've recovered to help other people. How many times can I donate over the next, say, 3 to 6 months?
I think only once, because the antibodies don't have the staying power. The neutralizing antibodies that help a person who has early stages of infection. That's almost once occurrence, because 3 weeks into, 6 weeks into, 8 weeks into it, you may have very less antibodies. So you're just giving them plasma, but not antibodies.
All right. Hey, one last question. Another reader I'm trying to let you go, but how many times can you get the vaccine? Can you? And is there anything if you've had 2 doses of Pfizer or Moderna? Is there anything beneficial to take the Johnson & Johnson when it comes out in a year or something?
Those are good questions. It depends on where are we in our fight against the pandemic. If we already won the battle, then it's over. But I don't think there will be any hesitation on my part to take the J&J Johnson & Johnson vaccine if I feel there is a degree of threat from the virus. For now, I would say no, but I'll let the virus and hopefully our behavior determine and negate that possibility to happen.
Okay, perfect. Dr. Bridge Bombi, thank you, sir. I appreciate you sticking around. Appreciate it. There you go. All right.